they're looking for about 95% of the community to be immune to protect all of us. And it's starting to dip below that number, even on something like measles, which is airborne.
Right, but if you have been vaccinated, you shouldn't panic because you're not going to
You could get it, but you would get a milder form, is what they say.
Yeah, it's just almost like a cold. But the 10% can't go to school unless you get vaccinated. It's
more
pretty
and
easy.
more. This is going to be a big issue for these politicians going forward because it's about Big Brother. But on the other hand, some things do require some involvement of Big Brother.
Interesting conversation with Megyn and Bill last evening, agreeing, both of them, the government should be involved in the measles outbreak, the vaccination aspect of it. As health officials are now battling more than 100 cases across the country, 14 infants said to be under quarantine in the state of California. Want to bring in Dr. Richard Carmona, served as the 17th U.S. Surgeon General. He's also professor at the University of Arizona, with us now from Tucson. Doctor, welcome back, and thank you for coming back.
Thanks.
Happy
to be with you, Bill.
This is an active debate, and both sides argue for and against. It doesn't matter Republican or Democrat. Let's be basic about this for the sake of our conversation now. Question: why should we believe the science?
The science is overwhelming. It's been tested over half a century. If you go back pre-1957, almost every child got measles, and it was a challenge. There were a lot of complications, pneumonias, moms who were pregnant getting infected, lots of problems. Today, we've virtually wiped out measles because of immunization, and they've been proven to be very safe and no major complications. Sometimes there are slight complications, but the overwhelming evidence says this is a good practice, and it saves our country a lot of money and reduces morbidity and mortality.
But you know there are doubters, right? And I know you've heard them before. Why do people doubt the science, Doctor?
Well, there's a lot of emotion, and many of the people, when I was in office as Surgeon General, many of the people that challenged us were talking about emotion. You know, they had a child who, sometime after getting immunized, was diagnosed, for instance, with autism, and they blamed it on the vaccination. During my tenure, we had several studies we looked at. We polled universities. There was no evidence. Since that time, more evidence has evolved that there's no relationship. It's hard to fight the emotional response with the science, but the science is clear. All children should be immunized, not only to protect themselves and family, but to protect our nation and keep health care costs down.
Okay, you know, Rand Paul was asked about this. He's a doctor, an ophthalmologist. Apparently, by all accounts, a pretty good one, too, in his former life in Kentucky. Chris Christie was asked about it. The president talked about it. Hillary Clinton talked about it. Here is Rand Paul specifically, just giving a bit more explanation for his position.
Yes.
I've heard of many tragic cases of walking, talking, normal children who wound up with profound mental disorders after vaccines. I'm not arguing vaccines are a bad idea. I think they're a good thing. But I think the parents should have some input. The state doesn't own your children. Parents own the children, and it is an issue of freedom.
What he said was he did not want his kids to line up and get all these vaccinations one after the other. And he, as a doctor now, he recommended staggering these vaccinations. Now, is that,
well, Bill, in fact,
is that a resolution?
Well, it's not a resolution, Bill, because already the vaccinations are actually staggered over many years, depending on the vaccination they get, just for that purpose. We don't want to overwhelm the child. But the current vaccination standards are ones that are approved by the CDC, other organizations, American Pediatric Association, who study this information, and the staggering is one that all the scientists have agreed on. So I think, again, the challenge is becoming the individual right versus the collective right of society. And clearly, every mother and father should be able to weigh in, ask questions, and get informed consent about the risks and benefits of a vaccination.
And you know that was Senator Paul. That was Senator Paul's big point.
Yes.
I think some parents should have an input. The state does not own your children. Final question here quickly. What is the impact on a topic like this when national politicians get involved?
Well, I hope that the national politicians speak with their surgeon generals, health directors, medical directors, and get the right information, because often the public gets confused because they hear public statements answering a scientific challenge. And that becomes very confusing, as it was with Ebola, and it's starting to be confusing now. All children should be immunized. We hope that parents would be educated and take that step on their own. But the government does have a compelling interest to keep its society healthy and safe. And if it's necessary, they may require immunization to keep our nation safe and secure.
Well, Doctor, thanks for coming back. It's a debate that will continue, as you well know. And
it will. Thank you, Bill. I appreciate it.
A lot of emotion, too. Appreciate you coming back. Thank you, sir. We'll talk again very soon.